Okay, so we are going to do a left knee hyaluronic acid injection as number 3 of a series of 3, and I'm going to be doing it through the anterolateral portal of the knee. There's multiple ways you can get into the knee. I just choose to do this because of ease of positioning and ease of getting into the joint. So anytime doing this injection, main things you look for are anatomical landmarks, which include mostly the patella initially. So I'll palpate the superior pole of the patella. You can mark it out with a pen or marking pen, and the lateral portion of the patella, inferior pole of the patella, and then you can actually palpate, generally in most patients, the edges of the patellar tendon. So in this patient's knee, I'm going to draw those as 2 lines. That's basically the lateral edge there and medial edge of the tendon there. And then you can palpate until you fall into a soft spot right over the lateral tibial plateau, and that'll kind of tell you where the joint line is. So you can draw another line there, kind of telling you where that lateral tibial plateau is, and between where the inferior pole of the patella is, the lateral edge of the patellar tendon, and where the tibial plateau is a soft spot where that anterolateral portal is, and that's usually the site for injection. So in this patient, that'll be right there. And then when injecting, steps are marking your landmarks. Next, you sterilize the skin with whatever sterilization technique you want, and of course that rubs off all of my anatomical landmarks. And you can confirm one more time exactly where we're going. I actually use the back of my chlorhexidine prep to mark it in the skin, so it just indents the skin a little bit there. And we let that set up. And whether you use a topical anesthetic or not is up to the clinician to decide, but I usually like to do that. Most patients do appreciate having that topical anesthetic available. It takes away some of that initial sting. So cold spray here. Usually spray this for about 5 to 6 seconds until you see blanching of that spray on the skin. And usually with these injections, I use a 22 gauge needle for injection, so their skin got blanched. And then as soon as that happens, we can take the injection and we'll poke here and right into the notch without hitting any sort of bone. And as long as you have smooth flow, you know you're within the joint. You can also choose to aspirate if you want to make sure you get some fluid return to completely be sure of being in the joint, but usually with a smooth flow it's pretty easy. And then you just place a little bit of pressure and apply a Band-Aid, and that is it.